Coming up.
People are dying. Look, I'm going to go to May 31st. You said safe supply is the real antidote to the toxic drug crisis. What are you doing to scale up safe supply so that it's available to anyone?
Usual dose of fentanyl in medical procedures. I understand you're a physician, perhaps not practicing for a while. If you don't know it, that's okay. Nope. Fentanyl, 100 micrograms. 2.5 grams of fentanyl would be enough to treat how many people? I'll give you the math just so we can move through this. 25,000 people. 25,000. So we're allowing people to possess enough fentanyl of medical treatment doses for 25,000 people.
This Guy's Garage. Like and subscribe.
June 1st, the day after the announcement of a limited exemption to the Controlled Drugs and Substances Act for British Columbia, the Minister of Justice was reported to have said, quote, "There isn't at this stage any larger discussion on decriminalization," end quote. So my question is, why isn't this happening? Because it seems to be conflicting to what you're saying today, that you're open to the other applications that are coming. I mean, I guess what I'm wondering is what happens if a community like Dawson City applies? Are you going to support resources so they can actually get an application in, or a small remote First Nation in Saskatchewan where they've got an overdose crisis, for example?
I am willing to really accept all applications, but the kinds of criteria that were in there for BC, like law enforcement training, like increasing the health and social services, we need to see all of those things in order for it to be a successful application.
Minister, in 2020, 73% of the people that died of a toxic overdose died outside of BC. And the stigma of criminalization will continue to cost lives across the country. Why isn't this conversation happening outside of British Columbia? And what are you going to do for those small communities that don't have the resources to do a comprehensive application like British Columbia?
Well, I think you and I have had this conversation before. We need the public safety criteria, as well as ramping up the health and social services before we can actually begin that conversation. We have to know the health and social services are there, and we have to know there won't be any unintended consequences in public safety, like gangs, organized crime, and the things that we have seen if you do not have a very strong implementation plan.
Minister, you had an expert task force on substance use. They were unanimous in saying that criminalizing people who use substances needs to end. Unequivocal. So I'm wondering, are your government policies, on this issue based on evidence or on opinion polls?
It's absolutely on evidence, but it's also on the evidence that we had from the frontline organizations that wanted to make sure health and social services were ramped up. You cannot divert people from the criminal justice system to health and services if they're not there.
Minister, they were unanimous. Your own expert task force is unanimous. The evidence is clear. 27,000 people are dead. You don't need more evidence. You don't, Minister.
We need an implementation plan, and that's what we're going to get. We have to have an implementation plan in order to be able to approve these. And so I am very excited that the conversations I've had with that expert task force, people are excited that that big steel door has been cracked open, but it's going to be cracked open safely. We do not want to have what happened in Colorado.
Incrementalism is what's killing people on substance use and the government's response. People are dying. Look, I'm going to go to May 31st. You said safe supply is the real antidote to the toxic drug crisis. What are you doing to scale up safe supply so that it's available to anyone who's at risk of drug poisoning in this country? And Minister, I asked your colleague, Minister Tassi, the Public Services and Procurement Minister, if she's procuring any safer supply. You know what she told me? She said she's waiting for a request from the Minister of Health or yourself, and she hasn't gotten one. Why?
I think you know that's not how it works.
That's how she's told me how it works.
No, it's not how it works.
That's the Minister is on record at the Committee of the Whole saying that it requires a request from yourself or the provinces. So if a province requests safer supply, will you provide them with a safer supply?
So at the moment,
and in COVID-19, we know, vaccines save lives, so does safer supply.
I agree with that, but I also agree we have approved diacetyl morphine, the injectable heroin at Health Canada, but the pharma science company is not ramping up to produce it. We need all of these things, but we need doctors to be able to prescribe it because there's lots of it out there. Dilaudid, what Christy Sutherland's doing in the downtown east side on powdered fentanyl.
Minister,
We've
you're
got
even saying
lots of
yourself that you
ideas.
can't access what you need. Why isn't the Public Services and Procurement Minister doing it? Anyways, I'm going to leave that with you because I've got more questions.
You're past it. Over to Dr. Ellis.
They know they will have some wrinkles.
Dr. Ellis, please.
Thank you, Mr. Chair, and through you to the Minister. Minister, can you tell us which country is the biggest threat to Canada with respect to importing fentanyl?
My evidence is a lot of the fentanyl's being made here now.
Okay, well, that's probably not what experts would say. That being said, it's coming from China, and that's a very important thing. Maybe I'll come back to it. Usual dose of fentanyl in medical procedures. I understand you're a physician, perhaps not practicing for a while. If you don't know it, that's okay. Nope. Fentanyl, 100 micrograms. 2.5 grams of fentanyl would be enough to treat how many people? I'll give you the math just so we can move through this. 25,000 people. 25,000. So we're allowing people to possess enough fentanyl of medical treatment doses for 25,000 people. How much Narcan do we expect the police to actually carry around? Are they going to fill paddy wagons full of Narcan doses? Nonsensical. How could we possibly say that that is an appropriate amount? 25,000 medical doses of fentanyl.
I think, Doctor, you know that what is on the street is not pure fentanyl. It's been cut with all kinds of other things, and that is the reason it's so deadly now.
Okay, well, let's say it's 10,000.
Diazepams. It's filled with all kinds of things that Narcan doesn't even touch.
Okay, 10,000 doses. Is that appropriate?
Doctor, I think that the fact that we have all the law enforcement agencies on side with this, as well as public health, means that we are beginning by beginning. We're going to start by starting. And that, as you know, the original BC application was 4.5. The Vancouver approach had different amounts for different drugs. This is, the police have asked us to have a cumulative amount because it's much easier to enforce.
One more question. Interestingly enough, could you please table the documents that really justify the 2.5 grams of fentanyl, please, Minister, for this committee?
I think I've just explained that 2.5
No, that's not what I asked, ma'am. Could you please table the documents?
I'm going to tell you that I can table the documents that show that...
No, that justify the 2.5 grams of fentanyl, 25,000 treatment
That is not
doses.
what
Okay,
we
you're
approved.
past time, Dr. Ellis. Please let her answer, and then we're going to move on. Go ahead, Minister.
We approved 2.5 grams cumulative of whatever a person is carrying. And as you know, there are many people using drugs who think that many people using drugs would use that. We are also getting criticism from the people using drugs that that's not enough in terms of what people's daily dose would be of the street version of it.
Okay.